A nursing assistant asks you to explain how the medications prescribed for treatment of myasthenia gravis work and why the dosage has to be adjusted periodically. Using pyridostigmine as your example, what information would you give the nursing assistant? So what is myasthenia gravis? Myasthenia gravis is an autoimmune condition where the body attacks the receptors that allow for voluntary muscle control such as the eyes, throat, face, arms, and legs, which leads to muscle weakness. Signs and symptoms of myasthenia gravis include weakness in the neck, face, arms, and legs, eyelid drooping, appearance is mask-like, the patients appear very sleepy, keep choking and gagging when eating, no energy, extraocular eye movement, strabismus, slurred speech, shortness of breath. Muscle weakness gets worse with activity but will improve after resting the muscle. It's like a normal person's battery, and they can use it up and charge it and it will go back to normal. While a person with myasthenia gravis, their battery starts to drain and they can't get it to charge it up either. So we have our motor neurons which release neurotransmitters called acetylcholine at the neuromuscular junction, which then binds to nicotinic acetylcholine receptor on the muscle cell membrane. Binding acetylcholine to its receptor activates a chain reaction to the muscle cell that ultimately results in muscle contraction. In myasthenia gravis, the patient's B cells inappropriately bind to acetylcholine receptors on the muscle cells. Once acetylcholine are bound to the antibody, they are unable to bind to acetylcholine and therefore don't respond to contract signal to the central nervous system. If you don't have a lot of these receptors, then those muscle fibers won't contract like they should, and therefore the patient will experience weakness.
Can you explain how the medications prescribed for treatment of myasthenia gravis work?
Acetylcholine esterase is an enzyme that breaks down acetylcholine. And in treating myasthenia gravis, anti-acetylcholine esterase medications are often prescribed to prevent the breakdown of acetylcholine. An example of this is pyridostigmine, which can be taken orally, intramuscularly, and intravenously. It must be taken 30 minutes to an hour before a meal. Since acetylcholinesterase degrades or break down acetylcholine, acetylcholine inhibitors stop acetylcholine esterase from breaking down acetylcholine. As a result, it then ends up increasing the concentration of acetylcholine around the muscle cells, and it helps counteract the effects of acetylcholine receptor antibodies. So therefore, the more acetylcholine will be readily available for those limited receptors and will increase and improve the patient's muscle strength. With myasthenia gravis, prolonged use of a muscle can cause the immune system to attack those receptors and damage or block some of them for a little while, so they can receive the acetylcholine, which only waits around for so long before it is destroyed. What pyridostigmine does is it keeps the acetylcholine from being destroyed so fast so that the working receptors have more of a chance to get it and to let the muscle work.
So why does the dosage have to be adjusted periodically?
So there's a condition called tachyphylaxis where the antibody receptors in the neuromuscular junction lose sensitivity to the same dose. It is the rapid decrease in response to the repeated doses over a short period of time. For that reason, it was taken into consideration the complications when taking medications. The two are myasthenia crisis and cholinergic crisis. In order to differentiate the two, a tensilon test or edrophonium is given. It is used to diagnose myasthenia gravis. Myasthenic crisis happens when there is not enough anticholinesterase, while cholinergic crisis happens where there is too much anticholinesterase. Consequently, the effect in taking an anticholinesterase like edrophonium is increased muscle strength in myasthenia gravis and decreased muscle strength in cholinergic crisis. Atropine is given as an antidote because it is an anticholinergic which reverses those signs and symptoms. Sometimes, patients hold off taking a dose if they don't feel symptomatic in order to avoid this. We need to remember that myasthenia gravis has no cure. The key thing to understand with pyridostigmine is that it has a short half-life. When you take a tablet, it takes maybe 30 minutes to kick in, and that tablet will stop having an effect after about 4 to 5 hours, at which point you take another one if you think you'll need it. It's important for the nurse to understand that there is no loading dose for pyridostigmine. It doesn't build up in your body over days. You take it, it works, then it stops working in a few hours.